Afternoon. My name is Dr. Trudy Ufondo of Snowspirations, Global Health Solutions. Today it's Wednesday, the 21st day of July 2021, and it's our popular community health open clinic. So thank you and welcome to today's clinic. Today's clinic is actually a very special clinic because we're going to talk about the men. So we're going to talk about male infertility. And specifically, we're going to talk about a particular condition we call varicocele. Varicocele. We're going to try and see the relationship between varicocele and male infertility. This is a topic of great importance. So if you're currently having infertility problem and you're a man, and they told you the problem why you can't father a child is because of varicocele, I want you to pay special attention because part of the problems we have that actually made so many people not to become parents is because of timing. You see, the time we diagnose a medical problem is as much important as the diagnosis and the treatment. When you have a medical condition, when it's diagnosed early, we can begin the treatment on time and you can have a chance to have a good outcome. This is also applicable to infertility. Remember that infertility is not just a female problem. Infertility is 50-50. Infertility can come from the woman. Infertility can come from the man. On this very day, we are going to shift a little bit from women because virtually everything I've been talking about is based on women. But today we're going to talk about the men. What are those things which can happen to a man which can delay his ability to be a father? One of the causes of infertility in males is what we call varicocele. So please quickly rally. If your partner is right there with you, invite him. If your partner is not able to attend, please share this video with your partner much later. If you're in Facebook, you can join us from my timeline. You can join us from our page and our group. If you're in YouTube, please join us in YouTube. When you get to YouTube, please check Snowspirations Global Health Solutions channel. Subscribe, like, comment, share. There are so many things that will help you. Remember that on the 25th of this month, we are going to go there with infertility. We are going to make IVF, IUI, surrogacy, adoption, and other forms of infertility management very simple. If you are planning to go for IVF, regardless of where you live, please come and acquire the knowledge so you can change your attitude, so you can change your practices, so you can become a father and a mother in 2022. So registration is currently ongoing. If you are planning to go for IVF, you need the knowledge and you need the right kind of provider. There are so many people that claim to be IVF providers out there. They are not providers. They are only interested in your money. But this afternoon, once you come in, confirm you can see me. Hold on. Confirm you can hear me. Follow my admin. If you need to subscribe, you can come in for 1 week, 1 month, 3 months, 6 months. If you're pregnant, go to our ANC group. If you want to be a mother in 2022, go to our Believing for Baby category in Telegram. Now let's get down to the business of today. So one of the things that can make a man not to be a father, which is temporal anyway. So anytime you are having delay in becoming a father or a mother, it's not a permanent thing. It's a temporal thing. There is no form of infertility, be it primary, be it secondary, that we cannot fix. All couples who are having problems, having babies, can get help. Now, one of the problems a man can have in regards to being a father is what we call varicocele. You see, this is a very important structure in the whole equation of becoming pregnant. But the most important structure in becoming a man, in becoming a father, is the testicles. So the testicles is housed in the scrotum. The testicle is what we call balls. There is a particular reason why it's hanging outside the body, because the temperature needs to be colder compared to the rest of the body. Now, inside your testicle as a man, that's where you produce your sperm. Production of sperm is number one thing when you're planning to be a father, right? Now, when that sperm is produced, it's important it's conducted to the penis during the act of lovemaking. At the peak of lovemaking, your partner will ejaculate. Ejaculation is the process of releasing the semen, which is what you can see visibly. Now, unfortunately, in some men, they will have this condition called varicocele. In varicocele, there are veins inside the testicle and the scrotum. Now, these veins, their duty is to conduct blood from the testicles and the scrotum back to the heart. Now, the reason why your partner will get erect is because when your partner finds you intending to make love to you, there will be entrance of blood into the penis, and the penis will be erect. When you are done with lovemaking, when the penis relaxes, blood will leave the penis, and the penis will go limp or flaccid. Now, in varicocele, there is a particular blood vessel we call veins. Unfortunately, veins have a one-way valve, so veins can only return blood back to the heart. In men that have varicocele, for some reasons, the veins will be distended. The veins will be swollen, which we call varicocele vein. So some vein that can get swollen in your legs can get swollen in the scrotum, in the testicles. When this happens, there will be no free flowing of blood from the testicles back to the heart. When this happens, you will notice that you will have swollen testicles. So blood can no longer go back. And when blood can no longer go back, blood will build up in the testicles, leading to this condition we call varicocele. This can lead to primary infertility or secondary infertility. Now, there are different categories of varicocele. Thankfully, it can be handled if it's noticed on time, if it's diagnosed on time. So varicocele is a situation where there is distension and swollen in the veins, in the penis, which returns blood to the heart. When this happens, it's going to affect the function of the tubes, which will return and open the veins and open the tubules in your penis so you can ejaculate. This is a problem. This can lead to infertility. This can also lead to pain in the testicles. This can also lead to atrophy. Atrophy means the balls will start shrinking. So if you're a man and you notice that suddenly the size of your testicle is reducing and you normally feel pain, especially when you sit or stand for a long time, it's possible you have varicocele. Let me repeat again. If you noticed that your balls are kind of feeling like kind of worms, so in medical practice, varicocele, when we examine the testicles and the scrotum, your testicle and scrotum will feel like bag of worm. If the normal volume of your balls recently you notice is reduced in size, it's called atrophy. This can be a sign you have varicocele. If you normally feel pressure or pain when you sit for a long time, or when you stand for a long time, or when you are exercising, and you notice that if you sit for about 1 hour, you stand up, you feel this kind of pain or fullness or discomfort in your testicles, in your scrotum, please book an appointment to see a urologist. A urologist is a specialist that will examine your reproductive system. There are a couple of investigations we will conduct to diagnose varicocele. It must be diagnosed early. The treatment must be started on time. If we can diagnose it on time and we start the treatment, there are actually two types of treatment. The first one is surgical ligation. We go there and we correct it. The second one is non-surgical approach to the what we call embolization. So it can be handled. The problem in varicocele is the fact that when this happens, it will lead to increase in the temperature inside the scrotum. Remember, For a man to produce sperm, we don't need the balls to be high in temperature. When the balls is high in temperature, it will affect the process of spermatogenesis. This is a very important step in diagnosing male infertility. So besides low sperm count, of which varicocele on its own can lead to low sperm count, can lead to low mobility and poor abnormal sperm, because when the free-flowing pattern of the sperm getting into the penis is disrupted, your partner will not be able to father a child. So it's important that if you are having infertility, you don't blame the woman. You make it a point of duty to go with your partner to a fertility specialist. If need be, you see a urologist. If you are having the complaint I mentioned, some men will not have symptoms. The majority of men will notice that they feel pain in the scrotal area. They feel pain when they sit for a long time, when they stand for a long time, and they notice that the volume of the testicle is reducing. So pay attention to your balls. Very, very important. You have to know. When you know better, you can act better. When you don't know better, you might be delaying, and delay is deadly when it comes to starting your family. So thankfully, varicocele can be diagnosed appropriately. There are special form of investigations we can use to diagnose that. We can examine the balls, and we can now send you for further tests. Once we diagnose that, depending on the extent of varicocele, you might be required to go for surgery, or you can go for the embolization if that facility is available in your location. But it's possible you can still get help. Majority of men that had surgery to correct varicocele still went ahead and became fathers. But if you don't correct it, you might end up not being a father. So this is the point you need to seek for help. If you are having infertility as a man, most women, 99% of women, will be worried. Most men will blame the women. This is not the time for blaming. This is the time for action. So I'm encouraging you, if both of you are looking for a baby and you are not able to get pregnant, you're 35 years and above, after 6 months, please see a fertility specialist. Make sure your partner is going with you. When your partner gets there, your partner will be referred to a urologist. A urologist will take time and examine your partner to see if there is a problem somewhere. Varicocele is a known factor that can lead to male infertility. Now, if you are below 35, make sure you at least try your PPP, pray, play, practice for 12 months. So do your own best. Don't be in a hurry. Don't go panicking when you haven't gone through the natural means. Some people don't have infertility. What they have is lack of lovemaking. What they have is fear. What they have is just not understanding the pathway of getting pregnant. There is no woman born barren. There is no man born barren. What you are having is a temporal problem. If you are having infertility, when we diagnose that, we can help you to get solutions. Very important, simple, straightforward broadcast. So most men that have infertility, when we hunker down and investigate, we discover that some of them will have varicocele. So varicocele can lead to male infertility. Thankfully, it can be corrected. So this is not something you will drink abo, or you drink herbs, or you drink a particular drug and it will be corrected. No, you need special attention from a urologist. So if you are attending my clinic today and they told you you have varicocele, some people unfortunately have gone for surgery and the infertility is persistent. When that happens, when we confirm that you are okay and your partner is okay and you guys still not able to have kids, then you have what we call infertility of unknown origin. If you suffer from infertility of unknown origin, it's strongly advised you consider RT. There are so many ways you can be a father. There are so many ways you can be a mother. It's not only one way. Remember that this is July. We have 6 months to end of 2021. If you are looking for a baby, please, you need help. You need a fertility specialist. If the problem is coming from your partner, your male partner should start paying attention to this group. Unfortunately, most men have pride. Most men are living in denial. Most men are not accepting that the problem is coming from them. Some men have erectile dysfunction. Some men have low sperm count. Unfortunately, some men have azoospermia. You no longer have sperm. If you find yourself in the category of men that are having infertility, kill your pride. Go and seek help. Use your resources. Avoid drinking. Avoid alcohol. Sleep a lot. Drink your water. Then seek help. Exercise. Make sure you exercise for at least 30 minutes. Watch your body weight. When you do all this, you can even become pregnant, even with the varicocele. You can even become pregnant, even with the low sperm count. Unfortunately, if you have azoospermia, you will need donor sperm. But you can be a father, despite the challenges you're having. But how you be a father is dependent on how soon you seek help. We can help you in this group. What you need to do is to come live and go through subscription. So you can come for 1 week, you can come for 1 month, you can come for 3 months, and you can come for 6 months. And make it a point of duty to attend our clinics. There is no day you will show up and you won't learn something new. So if your partner is having this problem today, we can help him. It's not the end of the world. You can still be a father. Are you listening to me right now? Even if you have low sperm count, continue making love to your partner. You can still get your woman pregnant, even with your low sperm count. Unfortunately, infertility is not just a one-factor thing. Your part might be okay, the part of the woman might be okay, but the tube is blocked. The tube might be open, but you're not ovulating. You might be having normal ovulation and the tube is okay, you might have hormone imbalance. There are so many things that can lead to infertility. Our duty is to identify the problem. So deploy your resources so you can be who God said you will be. There are kids in your ovaries. There are boys. There are girls. There are twins. There are triplets. There are quadruplets in your family, in your future. You can become a twin mother in 2022. You can become a twin father in 2022. You can become a triplet father in 2022. You can become a triplet mother in 2022. You can have 4 babies at the same time. How can you succeed? You need to ask for help. You can no longer just pray. You can no longer show up and you say you claim other people's blessing, but you're not doing your part. We want to become mothers. We want to become fathers. If the problem is coming from your partner, I challenge him to be man enough to go and seek help. If your partner is not attending this clinic live, share this video with him. When you go back home today, have a family meeting. Have an overview. What have we done since January? What did we do in February? Do we have a fertility specialist? Have they discovered what the problem is? What are our best solutions? He told us we're going to go 5 years. Do we have the best provider? What about IUI? Can I go for donor X? Can I go for donor sperm? Understanding the role of your age. Understanding that as a woman, when you no longer have X, you can no longer become pregnant naturally. This is something you need to understand on a daily basis. Anybody telling you any other thing is deceiving you. Okay, so guys, I'm going to open the clinic now. And I'm going to start taking care of your questions, okay? So focus on my admin. Admin is going to be moderating. Okay, Dr. Ndiche should also be in the house. So Dr. Ndiche will also be providing you with feedback, okay? So guys, start asking your questions right about now. If you have questions, go ahead and start asking. Someone is asking where we are located in Lagos. Unfortunately, I can only refer you if you're a subscriber. So if you want the best provider in Lagos, who happens to be the guest presenter on the 25th, which is Sunday, by 9 p.m., you have to come in as a subscriber. We have our results. We don't joke. When I'm referring you to a complete gentleman, someone that can respect you, someone that can give you the best, and you can become but I cannot refer you if you're not a subscriber. Why is it important you are a subscriber? Because I need to know who you are. I need to know your medical history. I need to know your age. I need to put the clinical information so that when I'm referring you, I'm telling him that Mrs. Okeke is having this problem. Then we can solve your problems together. So if you're interested, follow the admin, and admin is going to attend to care. But right now, guys, ask your questions. Okay, so I think I have the first question. Hold on. Okay, let me see. Okay, what is proximal bilateral tubal blockage? Unfortunately, my sister, when you have bilateral proximal tubal blockage, it means that the part of the tube where the sperm can come in, which is closer to the womb, both of them are blocked. So you can produce all the eggs in the world, but if the sperm cannot come in, either from the left tube or the right tube, you will not get pregnant. My sister, unfortunately, if you're listening to me this afternoon, if they told you that your two tubes are frankly blocked, if they are not partially blocked, if they are not moderately blocked, if they are completely blocked, both of them, you need to deal with reality. Is your reality. You need to go for IVF. Why? Because the eggs cannot come in. Because the sperm cannot come in. In some situations, the eggs and sperm can come in. But after fertilization, they cannot go back and implant in the womb. And you can have a ectopic pregnancy. When you have a ectopic pregnancy, what happens? Pregnancy, instead of developing in the womb, will be developing in the tube. Your tube is not structured in such a way to allow for pregnancy to develop in the tube. Any pregnancy developing in the tube is called ectopic pregnancy. We need to stop pregnancy and we need to cut off that part of the tube. Now, here is the good news. If one of your tube is damaged, but the other tube is open, you can still become pregnant, including having twins, including having triplets, including having quadruplets, if that's what God wants for you. But unfortunately, if you have a report of bilateral, bi means both of them. But if it's a unilateral blockage, if the left tube is blocked, but the right tube is open, you can still become pregnant. Okay, let's continue. That's a good question. Guys, keep asking your questions. Keep asking your questions. I'm going to be providing you feedbacks, okay? You have about 7 more minutes to ask your questions, and I'll provide you feedbacks. Okay, make sure your questions are very brief. Okay, let's see this one. Okay? All right. Make sure your questions are very brief. I'm practically straining my eyes. Your husband was diagnosed with varicocele and she's gone for surgery. And okay. So like I said, some men can go for varicocelectomy. That's the correction of the varicocele. If everything is done okay and is properly done, you can still become a father. Unfortunately, in some men, despite the varicocele, they might still not be able to become pregnant. If that's your situation, you still need to go further. The problem might no longer be coming from the varicocele. The problem might be coming from the sperm. The problem can be coming from the tube. The problem can be coming from the hormones. So we need to investigate further. But it's always advisable to address varicocele on itself. But it's not automatic that once you address a particular problem, there might not be other problems. Unfortunately, pregnancy takes a lot of complexities. So the woman must be okay and the man must be okay before you can become pregnant. So that's what happens. Okay, let's continue, guys. Okay, let's see this one. Okay. Okay, I've already provided feedbacks to that. Let's see. Okay, let's see. Okay. Doc, can IVF be done without a woman's menstruating? Yes. Now, some women can be menstruating and they are ovulating, right? The most important thing we need to confirm is that you are ovulating. Some women might be ovulating, but they are not bleeding. So once we confirm you are ovulating, we are going to give you ovulation induction drugs. What's ovulation induction drugs? Drugs that will challenge your ovaries to release all the eggs. It's called superovulation. When you release your eggs, we are going to check your partner to make sure that your partner has good sperm. So what makes a sperm good? The count, the motility, and the appearance. So if you are ovulating but you're not bleeding, we can collect your eggs. We collect your partner's sperm. We can get both of them together outside your body. Then we'll introduce it back into your body. This is simply what IVF is all about. Now, whether you are bleeding or not bleeding, keep on making love. There are so many women that will become pregnant, even without bleeding. So long as you haven't gone into menopause, so long as you are ovulating, you can become pregnant. So we are not really much bothered about whether you're bleeding or not. Unfortunately, some women dwell in, Doc, I haven't seen my period. Doc, I haven't seen my period. But we are not bothered about whether you've seen your period or not. We are more bothered about your ovulation. Some women can see their period okay, but they are not ovulating. Now, some women can have physical evidence that they are ovulating, but inwardly they are not ovulating. So even when you have increase in your cervical egg white mucus, you want it to go to a gynecologist. We want to conduct some special investigation that can confirm you are ovulating. Now, of all the women that are having problems having a baby, one of the most important tests you must have is what we call ovarian egg reserve. Ovarian egg reserve will give us an idea of the number of eggs you have and the quality of the eggs you have. You don't want to be wasting all your time going from pillar to post, and lo and behold, you have poor ovarian egg reserve. Unfortunately, if you have poor ovarian egg reserve, or if you have completed used your eggs, you need to go for donor eggs. So instead of wasting your money, go from pillar to post, meet a fertility specialist. We are going to conduct ovarian egg reserve. There are two important hormones you are going to look at: your anti-Mullerian hormone and your FSH, follicular stimulating hormone. The level of your anti-Mullerian hormone and your follicular stimulating hormone, we use an eye there. In some situations, we go into your ovaries and do what we call intra-follicular tracking to see if you are actually ovulating. One of the constants that must happen before a woman is pregnant is ovulation. Without ovulating, you can't become pregnant. So you must ovulate. Whether you're becoming pregnant naturally, or you're going through IUI, or you're going through IVF, or you're going through surrogacy, you must ovulate. Without ovulation, you cannot become pregnant. In the same vein with sperm, you cannot become pregnant. So the two important things that must happen in a family for you guys to have kids: the man must release a good sperm. The woman must ovulate. You must have a normal egg. Unfortunately, as you are getting older, you will have more abnormal eggs. So when you get to 35, you have a higher percentage of abnormal eggs. You might still have some good eggs, but you have more abnormal eggs. This is why you need to increase your frequency of lovemaking 48 hourly. So we don't preach ovulation sex. We don't preach fertility window sex. What do we preach? 48-hour sex. Why is it important to make love 48 hourly? Because you can only have an opportunity to release your egg within about 12 to 48 hours. Once the egg is released, if it's not fertilized, the body will absorb the egg and you will pass it as part of your bleeding. But the sperm, when the sperm is deposited in the vagina, the sperm can survive up to 5 days. So the sperm can still get the woman pregnant. So your partner can make love to you on Sunday and still get you pregnant on Friday. This is important. When you know better, my people, let me tell you the truth. If we know what we know today, so many people would have become grandmothers. So many people would have become grandfathers. But I'm still ringing the bell. It is too early. It is never late to become a mother. It is never late to become a father. It only becomes late when you don't take your chances. You can become a father in 2022. You can become a mother in 2022, but you need to do the right thing. You are not supposed to be sitting on the fence. You are not supposed to be on the fringe. When you need help, come in. Let's fellowship. If you need help from me, subscribe, come in, we discuss it. If you are ashamed as a man, if you feel you cannot discuss your problems with your partner, it's okay. Subscribe, come to me. We talk as men so you can be a father. Unfortunately, If you're in Nigeria, there is a way they see men that don't have kids. Whether you have kids or not, it doesn't change who you are. But if you're living in a society that castigates people that are having challenges, even in the churches, even in your villages, if you go for family meeting, they will tell you to sit down. After all, you don't have kids. You can stop that shame today. Some of you are pursuing, some of you are running from pillar to post. Some of you are not eating good food. Some of you are not exercising. When you got married, you used to have 6 packs. Now you have portal belly. This might be the only problem you have. My brother, let me tell you the truth. No matter the amount of money you have, no matter the level of buildings or cars or whatever, or how much money you spray in the public, most of the people that you're trying to impress are mocking you behind. But they are not your God. I'm giving you my secrets. I want to challenge you to climb the podium in 2022 to also be a father. My brother, there is absolutely nothing wrong with you. My sister, you are going through life challenges. This is life. We are all going to be challenged. Your infertility is not permanent. People are not God. Anybody mocking you will also watch and celebrate you. Some of the people you're trying to impress are happy you are having the problems. So you can come back to them, to complain to them. Some of the people you're complaining to, they don't care about you. This is a fact. But I want to challenge you today to rewrite your history. If you are not able to be a father since you got married, please do something. Do you know that some of the people you're taking your money to are hoping you will come back next month? Do you know some of the dubious pastors you are taking the money to? They will tell you to bring 1,000. So they will pray for you to do this, to do that. They will only use that money to go and enrich themselves. You can keep your 1,000. You can go down on your knees. You can pray to God, and God will give you directives. What you need is knowledge. What you need is changing your attitude. What you need is changing your practices and your perception. And you can become Papa Bomboy. I can become Papa Ejima. And look, I'm telling you the truth. Nothing stop you. So if you are listening to my voice today, you remember I said this. Nothing can stop you from becoming a parent in 2022. But I want you to start on time. A stitch in time saves 9. Our group is fully loaded with all the information you need. My brother, my sister, your infertility is not a quick fix. I can give you all the feedbacks I can give you today. If you don't take your bold step, you will be stuck in the same place. Please don't regret the actions you didn't take. Don't go and start envying people that did the right things and they became parents. 31st December, at least have a positive pregnancy test, my people. You cannot afford to cross over into 2022 with the same infertility. I refuse. I want you to repeat after me. I refuse to be a believing for baby mother. I refuse to be a believing for baby father in 2022. I am only gonna be a father. Worst case scenario, I will be in my first semester. I am gonna be a father in 2022. This is the promise that God made to me, and I'm gonna become who God said I will become. But I will do my own part. I will pray every day. I will play every day. That means I'm gonna make love to my partner. What the penis is interested on, you have to recharge your penis and you put inside the vagina and you keep making love. Love making works. Go back and start doing the right things. Some men do no longer sleep. They stay up late night pursuing money. We are all gonna get money. But the problem is, at the end of the day, when you get money, who will continue your generation? Who will continue your surname? I'm challenging you today to do something. Thank you for coming. Make sure you follow Dr. Ndiche tomorrow and also join my lunch break open clinic tomorrow. Register for that event. If you have been told you need IVF, IVF can give you twins. IVF can give you triplets. IVF can give you quadruplets. Some of the testimonies you are reading are women that came out and said, you know what? I'm done with infertility. One of the most amazing testimonies is a lady that went for surrogacy and succeeded in having identical twin boys. When she came to me, in 2019. We did everything possible to see if she can become pregnant, but she couldn't become pregnant. Now she met the partner, and both of them agreed that they will go for surrogacy. Guess what happened? What did they do for surrogacy? They still used the woman's egg. The only thing they did, they had another woman that carried their baby. Today, they are proud parents of twin boys. My brother, my sister, if you don't do nothing, nothing will happen. But if you do something, something will happen. I challenge you to go and use your resources. Be careful. So many groups in Facebook will derail you. So many groups in Instagram will derail you. If you don't remember, you are looking for something. Don't be distracted. There are so many distractions out there. Over the weekend, it was spraying money. It was fame. Now is a new dawn. Are you pregnant? Are you a father? Are you a mother? What are we going to do differently? I'm challenging you to do something differently this afternoon. Thank you for coming. Please share this video with anyone that needs help. My sole aim, by the grace of God, is to help. I am the John the Baptist calling you to mend your ways so that you can become. You will remember I said this next year. If you take your bold step, you will become a father. You become a mother. God bless you guys. I love you guys. Bye-bye for now.